no slides to come forward?
I mean,
There's visual, but there's no slides.
And guys, all of this, what Hussein's going to show you, will go up on our website tonight, www.mrmedics.co.uk. Okay, it will be available tonight.
I know a lot of you want to watch the game, or have already started watching the game, and if midway through, like, someone randomly cheers or boos, then I'll know what the score is. But I'll try and keep it brief. What time does the second half start?
6 o'clock.
Alright, so we'll aim to finish before then. Is that fair?
Yeah.
Yeah, okay.
You get my text? Oh no. Okay, just text. I don't think I have your numbers. Oh yeah, I got it too.
Okay, so yeah, so sorry about the sound. There's a note from IT to say it's going to be repaired tomorrow, but that doesn't help us. So just a structure of what we're going to do. I apologize that there's no slides. The reason there's no slides, last year when I gave the tutorial, I had like 100 slides or something, and they said it was too intense. So I tried to tone it down, but I was late. Like I just got off the plane a couple of hours ago, so I'm sorry I'm a bit late. But what I lack in slides, I make up for in spider diagrams and all other things, which are probably more useful to you. A few things to begin with. One is that I hope your science in the patient paper that you have to write finished successfully. And if you hadn't noticed already, year 2 is tough, even after the LCRS and all those exams. And unfortunately, that continues in science in the patient, the exam you're going to have in about 2 weeks' time, 10 days, whenever it is. When we were doing it, it was the World Cup, and so everyone passed all the LCRS exams, and then they went to watch the football, like you guys can. And I think I ended up getting, like, a lot of our group got much lower in the science and patient exam than all the others. And it sounds perverse because you work so hard for LCRS and then you let yourself down with science and patient. So we sat down with a lot of different people and said, "Why? What's going wrong? Why is it, so difficult? Is it because of the slides and everything?" So I'm going to try and condense all that, answer a few questions, and then if you've got any burning questions, you can ask them at the end. And I'm happy to stick around. I won't be watching the game, so. So the structure of the exam has changed somewhat. So the past papers you have online, and indeed the past papers that I have on the USB, which I'm going to give you, are not they are relevant and they're still useful, but they're not identical to the exam you're going to have now. Unfortunately, you're the second year where they've changed the format a little bit. So broadly speaking, there's 2 sections to the exam. You've been told that, yeah? Yeah. So first section is like a synoptic, and the second section is more case-based. If you've seen online, there's lots and lots of essays, or there's like 2 or 3 examples. I think the way you're going to get it is not one essay, it's going to be a case, and then they'll ask it in 5 structured separate SAQs or something like that. Because what people used to have a tendency of was they write the essay, and then they just go on and on and on. So one key point to take note of is, for the second part of the exam, make sure your answers are very focused and structured, because they've restructured the exam such that you are very precise in the way you answer questions. I'll give you some examples in a minute. For the first section, some people have asked me, and it's a valid question, that how much of year 1 and 2 do we need to know? And the answer is, unfortunately, you do need to know some of it. So I'm going to just go through what I think is relevant on the intranet and show you. The worst news for you is that LCRS drugs do come up. Yeah. So, and to the extent where I think last year there was a 10-mark SAQ on 5 drugs and their mechanism of action. Yeah. So, unfortunately, the good news is it's unlikely, I mean I say unlikely, never say never, but it's unlikely to be something really perverse and random about, it's much more likely to be something broadly related to the themes that you've covered now. So, you've done exercise, so it's not unreasonable to get like 5 cardio drugs, for instance. Yeah, so, and I think in our year we had that as well. So we had, this statin, that beta blocker, and you sort of roughly need to know what it's about. I don't think they're going to quiz you in the same level of detail like half-lives and all the rest of it, but don't assume that it's just the lectures in science and patient that are going to come up in the exam, because there's a lot of synoptic stuff. So if we go to year 1 to begin with, that's irrelevant, that is somewhat relevant. Now, I would focus, because you've done some endo stuff, so I would, there's one lecture here on the endocrinology of calcium metabolism. I don't know why, but every single year in medical school, even like irrespective of which BSc you do, SNP management, that slide, there's that one slide on parathyroid hormone. Do you know what I'm talking about? Yeah, I'll show you in a second, but it always comes up, like crops up somewhere. So if it didn't crop up in your LCRS exam, if you felt you were hard done by in the exam where there wasn't that much pharma, it was more HLC, then science in the patient is where they're going to come back and get you. So, yeah. Okay. So, I'll go. Now, the other thing is, for year one, there's a key topic here. You've probably forgotten it, but the urinary system. Do you guys remember any of these lectures? Okay. So the physiology of urine and kidney metabolism, and not kidney metabolism, like the process of kidney physiology, and the way that works is relevant because you've got questions about exercise physiology, you've got questions about urine output, and you've got questions about, you had lectures on kidney transplantation as well, didn't you? And renal failure, pre-renal, intrinsic renal, and post-renal. So that can all come up. So I wouldn't spend time doing that much on the anatomy of it, but I would look back at Paul Kemp's lectures and Michael Emerson's lectures, where he has like those diagrams that he's drawn on where like what percent is metabolized in, sodium is 80% here, 20% here. And if you have a rough idea of kidney physiology, it's helpful because like there's certain past questions that come up on, John was in the desert, 2 in the morning, and he's tired. Have you seen that desert question? Yeah, okay, so, and then you can bring that in. Unfortunately, because it's not an essay anymore, you don't have as much room to ramble. So before, let's say the question was John is in the desert and he's tired or whatever, talk about his physiology, something like that, those are the questions. You could almost talk about anything and bring in any sort of topics. The unfortunate thing for you guys is that now, because of the SAQs, they'll be a little bit more focused. So you don't have as much room for selective revision. You really have to know most of the topics. So if you've thought to yourself that, I've learned exercise, but I haven't learned anything about the pathology of infection, or I haven't learned anything about the renin-angiotensin system beyond what we did in year one, then you're going to have a problem. So selective revision doesn't really have a place in this exam because it's designed to be an integrator sort of thing. Any questions so far? Okay, I'll come back. I'm sure there's a lot, but I'll try and cover it a bit later on. So year two, again, so this is irrelevant, this is irrelevant. LCRS is very relevant. Anatomy and stuff, less so, but things like neuroscience, things like pharmacology is good. And even in pharmacology, there are certain things that are much more likely to come up. So things like atherosclerosis might act as lectures. And when you discuss, where is it? The to be honest, most of these could come up, I would say. So if you had made a drug list for your year two exams, that's a useful list to go back to. Now, if you're struggling a bit, the best thing I can show you for this exam is here. I'm going to put this up online, but basically there are spider diagrams. So you know that there's 5 or 6 key themes in the Science and the Patient course, right? Each week was a new theme. Is that right? Yeah. So you had so it's quite clearly delineated here. And then you can label it as exercise and then physiology of a kidney, acid base, and all of that kind of stuff. And so what you need to be able to do is synthesize that information in the exam. It's not going to be one where you immediately repeat parrot fashion what you learned in the lectures, as with year 1 and 2 up until now. It's more going to be, okay, I understand the renin-angiotensin system, I understand this is what happens if you have a bad acid base, and you have to try and synthesize it all into one coherent answer. And the best way to do that is spider diagrams. Okay, so I've got some here. I don't know if some of you have got these notes already, but they're actually very, very useful. So I'll see if I can flip this around. How do I? Where? Yeah, am I in the right pane?
Top option.
Rotate view. Okay. Clockwise. And then, okay, here we go. So there's 5 of these, 5 or 6 of these, and what I would do is I would use these, learn them off by heart if you can, and then what you can do is try and go from blank. So let's say you start off with diabetes. Think of anything to do with diabetes that you've learned in Science in the Patient. So you can relate it to physiological stress, and then how you have increased catecholamines and increased production of glucose, and then you can take it towards how to treat EKN, and you can learn about the drugs you learned for diabetes, yeah, so the glycosides and all of those things, sulfonurias. You learned about those, didn't you? Yeah, okay. So what I'm saying is quite broad ranging. And then you can even link it to diabetes compromises the immune system, in which case you get predisposed to infection. So what you want to try and do is be able to cross-link as many different themes as you can. So how can infection, or how can this specific infection relate to this one? And the more detail you go into this, so all of these things, you can easily write a paragraph on each of them. So for instance, if you take renal failure as another example, you can take it here and say renal failure is a uremic emergency, and then for each of these bullet points you can write a sentence or two. Now if you notice, there's some level of detail that is required, so like 10 millimeters of 10% calcium gluconate. Yeah, so that's the kind of, if you want to pass the exam, you can just say, 10% calcium, or you can just say calcium gluconate. But if you want to really do well in this exam, that's what they'll look for. Because you have to imagine that they're going to be marking 100 different papers, and they don't have that much time to go through individual details of each one. So if it's clearly, shown that you've got so much detail, you can write very, very quickly. They're not looking for long answers. You're not creative writing course you're doing. It's medicine, so they'll just have like very specific things like 10%, 15%, and if you've got those buzzwords, they'll just tick them off as they go along. And I sat with the incoming president, Shiv Vora, recently, and what he said about this exam is that more than others, because they've got so many papers to read, and because there's a lot of SAQs, they really much prefer you to signpost as much as you can and be as specific as you can. And also, you don't really have the time to be able to go into too much verbose behavior into this exam. It's very, very time pressured every year. And even now with the new structure, you have to be able to, I'm not sure quite exactly how it's going to be this year because you're only in the second year. But just commenting on last year and previous years, you have to be very clinical in the way that you manage your time. And let's say you're doing the SAQs on the synoptic stuff about the drugs and all of that. When you get to that and then you're thinking, I'm not really sure what I did and I can't remember year 2 physiology, at some point you do have to call it a day. Because it's very, very easy, especially in this exam, to get caught up in thinking, I can do it, just give me 2 minutes, I'll get this answer. But then you underestimate the time needed for the SAQs. And these brainstorms take a while to reproduce in the exam, like just in your head even. So you really have to be very ruthless with yourself in terms of how you separate your time, because it is time pressured. Probably one of the most time pressured exams you'll have encountered since the study period. Okay, so I don't want to waste too much of your time reading off the brainstorms, but I want to pick up on a couple of specific things. So you'll notice that this thing, so like features of sepsis, if I asked you right now, could you all tell me the 5 features of sepsis? Put your hand up if you could. 1, 2, maybe. Okay. There's a lecture. Sepsis is very, very important, not just because it comes up in your lectures, but generally in real life, it's an emergency. So, there's that lecture with blue slides. Yeah? Do you know which one I'm talking about? And then he describes clinical sepsis, and he also talks about systemic inflammatory
response syndrome.
I can't hear anyone. It's quite worrying when you say a couple of letters and people can't continue to say it. Sorry?
SIRS?
Yeah, so what is SIRS?
Systemic inflammatory
Response syndrome.
Yeah. Okay, and what's the difference between sepsis and that?
Sepsis is known infection, known or presumed infection.
Sorry?
Sepsis has confirmed infected cells.
Okay, and SIRS doesn't have a confirmed. Okay, I don't want this. So, by the way, just this is the slide I was talking about. Like they love, I don't know why, this slide comes up every single year somehow. If it hasn't come up, then something's really changed. But okay, so SRS, so you really need to know these definitions. So this one and how it differs from this one. And then, what may happen is in the case study, they won't deliberately tell you the patient's got sepsis. They may just say he's got infection of known cause, and they'll specify what organism it is. So they may say Staph aureus, and that will affect the management in that way. So, Staph aureus may have a specific relation to this treatment. It may be more sensitive to these antibiotics, and you need to be aware of this. The point that should hopefully come across so far is this is not an easy exam. But there are things you can do to help yourself. So those are the brainstorms. Did all of you attend the tutorials? You did? Do you have good notes for all of them? Okay, good. Because I have the mark schemes from the tutorial, from the lectures. So, actually not this one, I have them here somewhere. Basically, somehow, a few years ago, someone took the tutor's answers. And so this USB is a pretty gold mine thing, because you probably have patchy notes for some of these things, but you may not have specific. So some of this may be of relevance, but then you don't have all of these specific calculations. Yeah, and there's a few of them. Oh no, but they're there. So you have a look. Have you seen this SAQ?
Yep.
Have you seen this one? No? Okay, so I wanted to go through this one and a couple of others with you. This one is from a tutorial you had in Hammersmith Hospital with that guy who was, well, he probably was with that guy who wears like funny glasses. He gave the lecture. He talked a lot about, you know, there's a brainstorm here. Do you know which one I'm talking about? No? Okay, so I'll show you. If I can find it. Yeah, basically it's a pathway that shows when you get Staphylococcus aureus, what happens next, what's the next stage, and then how does it eventually lead to sepsis, or how does it go on that path, and what is the immune function that underlies that process. And all of this stuff can be gleaned just from the tutorials. So all of that. And do you see how, although it's 4 marks, you don't necessarily need loads and loads of words. You can just, in all of them, you can see like it's literally just 2 words that are giving you the marks straight away. So the time constraint is such that you don't need to be able to copy out in such detail. You can literally just name them very, very quickly. Is any of this familiar to you, or are you looking very, very worried? Very worried. Okay. In that case, let me show you a couple of more slides around, and let me give you a bit of hope. So when it was my year, I left it very, very late because of the World Cup. I think it was 3 days before the exam, and I didn't sleep for 3 days. But eventually, you can learn these very, very quickly. So what I would recommend is that you go home when these brainstorms go up tonight. Is I would print them all out, and if you want to, first of all read through them. And then you may want to write a page of notes or whatever on each of these areas. So you may want to do one on heart disease. You may want to do one on the response to to exercise in normals. You may want to do a response to exercise in people who are immunocompromised, in people who are famished, people who are thirsty, whatever, and how that differs. And then, if you can, try and replicate these diagrams from scratch. So what you'll do is you'll end up drawing them, and then you'll maybe get 6 or 7 of these arrows, and the other 2 you can't get. So then you go back and do it again. And also, you may find that as you're doing them, you may find your own new links to different parts of the course. The people who will do better in this exam are the ones who can bring in and tie in lots of different concepts. Because although the theme of the essay question, the case study, may be, let's say, exercise, the ones who can bring in stuff about infection, about kidney function, will be the ones who are better, rather than just saying, heart rate goes up, tactical aim is this and that. So the more different areas you can bring in, the better. Because what they probably do is they have a tiered system in the way that they give you the marks. So the bulk of the marks will be on that section. But once you've capped those marks, the more you talk about exercise, there's only a certain number of marks available to that. So you need to talk about something different and a different area in order to secure those other marks. Does that sort of make sense? Yeah? Okay. There's a few things I quickly want to go through before the second half starts. And that is that there are some PowerPoints that you have which look very, very rubbish, like the breastfeeding one. Remember that one? Yeah? And if I remember correctly, it's just got loads and loads of pictures and like about 2 or 3 slides with 3 bullet points, and then you think that's a useless PowerPoint. That's wrong. I think in our year we got like a 4 or 5 mark SAQ on the benefits for breastfeeding, both for the mother and the infant. So although these lectures look very, very funny and they look quite useless, like some of them, I'm trying to think of an example. Do you know what I'm talking about? A lot of these PowerPoints are very, very vague, and they don't look like they've got a lot contained in them. But then what that means is every slide you really need to know in quite some detail. So if we go back to the sepsis one, just to give you, like, okay, so this you know you're going to have to learn, this you know you're going to have to learn. But small things, like, although it doesn't clearly say to you that, where is it? Yeah, so like something like this, it looks so basic and funny, yeah, that, oh, of course it's going to have an impact on the brain and the heart, the kidney, the lungs and all of that. You do need to know every single slide because they don't cover much, but what they do cover they expect you to know. And I don't know if you guys have noticed, but on these ones, especially there's that Indian lady, she gives you the lectures on infection. You know, she has those brainstorms. Did she give you supplementary notes on her? Did she? Like, because her slides are also very, very patchy. Okay, I don't think you got them. Anyway, they're on my USB. You have a look at them when the slides go up. Basically, her slides are, you know, she does these nice quizzes with you and she gives you a chocolate bar or something. Yeah, but it's not very helpful to you the way that she presents her slides. So what I would recommend you do is go home, look at the slides, look at our slides, and in tandem with that, look at the notes that are on this USB somewhere. I apologize that it's all a bit messed up. Now, there's one here that I want to draw your attention to just before is Gaia's notes. And what she's done, I'll show you, is what you'll notice is that these 5 topics on exercise, nutrition, sepsis and all that, she writes a bit about them and then she tries to link it to other slides. So do you recall this slide from year 1? Yeah? So that's what you need to try and do. Although the lectures are quite patchy, you know, like that, whatever her name is, the sepsis one's quite patchy, what you need to be able to learn to do is think, okay, well, how would this relate to something I've learned in year 1 or year 2? How would this relate to something else I've learned in science occupation? And not necessarily that lecture. So, although in that specific lecture on water electrolytes, that the RAS system wasn't covered, you need to be able to somehow bring it. Now, I'm not proposing that you try and learn everything and all of this in that great detail. So, she's even gone to the extreme. Do you remember Nancy Curtin's lecture on how much percent is extracellular fluid, intracellular? So, she's gone to that much detail, and she's really tried to connect all the things back to year 1 and 2. So, if you've got time, those are the things you should do. But I don't think you need to go in, you know, phenomenal detail about this, but just so that you know, those are what's going to get you the mark. It's not going to be just a discursive discussion about like a clinical case. So there'll be a clinical scenario, but then you don't necessarily need to be very verbose in the way that you say, okay, now then his kidney falls down. You really need to be specific. And what you'll notice in some of these is that there's lots of numbers, there's lots of electrolyte pictures being given, and it all looks very confusing, but you do need to know the specific details in them, and that's what will get you the marks, rather than a generic discussion. Okay. Now, I know I've gone back and forth, but it's really because this is, you're only the second year to have this format, and there's really no precedent. So I've tried to give you a bit of a general overview. In terms of specific tips for the SAQs and the exam, just before we finish, there are some useful past papers here. And some of them are a little bit outdated and a bit old. But I would recommend that you go through them, not now, but once you've actually done something. Because as you know, it's very, very easy, you know, to look at it and pretend you know the answer. But you have to be very ruthless with yourself, because in each of these, they're quite specific in terms of what they're looking for. The other thing is, in our year, the year before, and I think last year, but I'm not sure, they had like a random graph which had nothing to do with what you've learned. We just had to be able to interpret it. So if you find that and you see it, don't get alarmed. So here, like describe a graphical method for determining the anaerobic threshold. In our year, they actually did give us a graph, and they told us, you know, what does this graph show, or how would you interpret this graph in light of this. This kind of SAQ, they may throw you off a bit because you're thinking, I haven't learned this. Because it's not a very prescriptive exam. So instead of like learning lectures, what they do instead is they will give you something, and they might throw you off a bit, but you have to take a step back and think of it in a broader context. Like, okay, I know how to look at a graph, I know how to interpret it, and you have to think of it a little bit differently. I apologize that it's a little bit incoherent. It's just because there really is no precedent for this exam. And I really sympathize with most of you, because it's difficult to say that what this is going to come up, this is going to come up. But just that if you are looking at me thinking, I haven't learned anything about infection, I haven't learned anything about exercise, I've just been on holiday for the last 6 weeks, it's not a problem. It looks like a lot to cover, but if you just go through the key brainstorms, if you learn the key sections from pharmacology, and if you go back and try and make as many links as you can with other parts of the course, you should be okay. What I did, I didn't really focus too much on the lecture slides because they were useful, but they were only like a starting point for the revision. So it's only to introduce the topic. So there are some that are comprehensive, like on pre-renal, intrinsic renal, and post-renal, which, yeah, you'd learn that lecture, you'd be fine. But there are others, like the infection ones, which are just designed to say, okay, this is the topic you need to learn, and then you need to go back and make the links to other parts of the course or other parts in science and the patient. So it makes sense? Okay. I feel like I've confused a lot of people here, but I'm happy to take any questions you have. Yeah.
You know our paper, the project paper, is like 20%.
Yeah.
Does that mean we don't need to get 50% from this exam? We still need half one?
Yeah. Basically, I wouldn't pay attention to anything Mirren tells you. Because you can do the math and say, I've done 20%, so I only need about 30 out of 100 to get passed in this exam, whatever it is. Don't rely on that. Because loads of us were assured we did well on because everyone was told before the exam, you've all passed, well done. And then you go in the exam and people failed the actual exam, so they were thinking, how did I get 30% when I did all right? Because we knew we did all right. So I wouldn't rely on that because that 20%, I'm not even sure, even having spoken to the education officers, whether that 20% is for this exam or whether that counts for the BSc Part 1, it's really undecided. So assume that that was a distraction from this exam. Yeah, it'll come up somewhere, but how they do the calculations, we're not certain, and don't play a numbers game because this is still an important exam. Oh yeah, I should also say, this was the exam people had to most resit, more than LCRS. I don't know about last year, but certainly every year before that, this is the most resitted exam. Only because of the second half, which is the SAQs, and only because people take their eye off the ball. Any other questions? Okay. Sorry, go ahead.
Would you recommend starting with the essay or SAQs?
So my advice always is that do what Imperial tells you. If there's anything I've learned in 4.5 years here, is do what Imperial tells you. Like if you go to even these tutorials, we tell you stuff with only our perspective. When Imperial tells you to do something, do it that way because there's a reason.